Hi, I am Dr. Naveen Mehrotra, consultant neurosurgeon from the Sunshine Hospital, Secunderabad branch. So, I am going to talk to you or share my experience with you on the topic, which is a very burning topic, called as minimally invasive surgery. So, when we were trained during residency, we were taught as the big surgeons make big incisions. But now this concept has been challenged, and we see everywhere being advertised as a needle hole surgery, keyhole surgery, or also to be called as minimally invasive surgery. So neurosurgery is also not aloof to this concept of minimally invasive surgery, and we do minimally invasive neurosurgery also. So what does this minimally invasive surgery means? So minimally invasive surgery means that we reach the area of interest, making the smallest possible incision with minimal retraction or causing damage to the surrounding tissue. It doesn't mean that we have to make the smallest incision and struggle to reach this area of interest. It means that we have an adequate exposure, we have adequate tissue respect, and reach the site and do whatever safe resection or what we intend to do it. There are three important areas or subspecialties of neurosurgery that we can do. One is the role of minimally invasive neurosurgery is in congenital or pediatric neurosurgery, where we do treatment of hydrocephalus by means of endoscopic third ventriculostomy. Second is the area of neuro-oncology, meaning thereby we remove tumors by minimal invasive techniques, especially the pituitary tumors or deep-seated intraventricular tumors. And thirdly, it is in the area of the spine, where we try to remove the disc or sometimes the tumor by minimally invasive techniques. So how do we do this minimally invasive surgery? So suppose we have a child who has got hydrocephalus and needs to be operated. The older technique was to put in a shunt and drain the fluid from the brain to the peritoneal cavity or to the stomach. Now with the advent of the minimally invasive surgery or endoscopic surgery, what we do is we make a very small coin-shaped hole in the skull of the patient, and we introduce an instrument called as the endoscope. This endoscope is a specialized instrument which has got good magnification and illumination, so that we reach the area of the interest, and has got some working channels through which the instrument passes and we do our work. So now what we have got precision of reaching the site, we have got better visualization, then we have got the specialized instruments to carry out these surgical procedures. So what happens with the advantage of this surgery is that the patient has less of operative trauma and can go home early. Number two, the post-operative pain chances are less. One of the commonest things that we do minimally invasive in the tumor surgery are the pituitary tumors. The pituitary tumors are the tumors which are in the base of the skull and are approached through the nose via an endoscope, and there is no incision at all on the skull for removal of the tumors, and previously we used to give big incisions on the skull to reach that area. The advantage is that we reach the area, there is no incision, there is no operative trauma, and then we remove the tumor. Almost complete tumor has been removable or is being done with the advent of endoscopes nowadays. Another important area for minimally invasive neurosurgery is the area of spine surgery, where we are doing endoscopic discectomies or sometimes the fixations and sometimes the tumor removal via these minimally invasive techniques. Still, these minimally invasive techniques are still under evaluation, but most of them have stood the test of the time and are being performed routinely to have a good post-operative outcome with minimal tissue dissection and having a patient a faster recovery with less post-operative pain. At Sunshine Hospitals, we have got the fully equipped neurotheater where we routinely perform these minimally invasive surgeries, including the child and the tumor removals. Thank you.